All Hi friends, today we'll discuss about some of the peculiarities of the clavicle. In my previous video, I have discussed about the clavicle in detail. So today I will discuss you something about the peculiarities of the clavicle. The peculiarities of the clavicle includes it is only long bone that lies horizontally. Usually all the long bones will be lying vertically. So this is only long bone that lies horizontally. So you can call it as a modified long bone. And it is only long bone that ossifies from membrane. So usually all the long bones ossifies from cartilage. So only long bone that ossifies from membrane. It doesn't mean that the complete part is developing from membrane. The entire part except the medial end or the sternal end. The sternal end is ossifying from cartilage. Rest every part is ossifying from membrane. That is also a reason for the next peculiarity, that is it has got no medullary cavity. Usually all the long bones, if you are taking, that shaft portion will be having the medullary cavity, the two ends will be made up of spongy bone. But here the entire bone is made up of spongy bone. You can see here. I hope it is visible for you. This is how a spongy bone will be lying inside. You can see, I don't know how much it is visible for you people. See, you can see sieve like areas here. Okay, this is how a spongy bone will be lying. So it is mainly made up of throughout by spongy bone with a thin layer of compact bone will be surrounding it. That's why it has got no medullary cavity. The next peculiarity is it is pierced by a cutaneous nerve, that is the intermediate supraclavicular nerve, and it is the first bone to begin its ossification, that is around 5th to 6th week of intrauterine life, and this is the last bone to complete its ossification. That means till the 25 years of your age the clavicle will be going on ossifying. And usually all the long bones ossifies from a single primary center of ossification, and it has got two secondary centers. Again here there is a peculiarity, that is clavicle has got two primary centers of ossification. So it has got two primary center of ossification and one secondary center of ossification. That's why usually the growing end is the secondary center area, that is will be the sternal end. Congenital absence of clavicle is referred to as cleidocranial dysostosis. Congenital absence of the clavicle. So clavicle is actually helping in the weight transmission, or it acts as a strut connecting your upper limb with that of your sternum. So weight is being transmitted from your hand, weight transmit to the radius, from the radius to the interosseous membrane, from the interosseous to the ulna, from the ulna to the humerus, and from the humerus weight is being transmitted to the scapula. You have seen the scapula. From the scapula, here you have seen that joint, how it is formed, coracoclavicular joint. And here I have discussed in the last diagram, last video about the ligament here, conoid and trapezoid part of coracoclavicular ligament. So through the ligament, coracoclavicular ligament, it is being transmitted to the clavicle, and from clavicle to the sternum, sternum to the ribs, and from the ribs to the vertebrae. So these are some of the peculiarities of the clavicle. And see this area where the medial 2/3, lateral 1/3 is meeting. This area is the most common area of fracture of the clavicle at the junction of lateral 1/3 and medial 2/3. It can be due to blow to the shoulder, or it can be because of any outstretched hand, fall from an outstretched hand, when the person falls on the outstretched hand or at the shoulder. So in such cases, the lateral fragment is being displaced downwards by the weight of the upper limb, because your trapezius is getting here attached. Trapezius alone is unable to support the weight of your upper limb. And in addition, we can tell the lateral fragment is drawn medially by the teres major muscles. Anyway, that is not that much important. Just you should know this area where the fracture is going to occur. Thank you.